Tuberculosis, TB, once thought to be largely controlled in many parts of the world, is re-emerging as a significant global health threat. The disease, caused by the bacterium Mycobacterium tuberculosis, primarily affects the lungs, though it can spread to other parts of the body. Despite advances in medical treatment and global health initiatives, tuberculosis has stubbornly persisted, particularly in low- and middle-income countries, and recent trends indicate a resurgence in many regions, making it one of the most pressing health concerns of modern times. Historically, tuberculosis was known as consumption, a disease that ravaged populations for centuries. In the early 20th century, the introduction of antibiotics like streptomycin and isoniazid, coupled with improved public health measures, led to a dramatic decline in TB cases in much of the developed world. It seemed that the fight against tuberculosis was nearing its end, with many countries declaring it a manageable or even eliminated disease. However, in recent decades, tuberculosis has made a concerning comeback, fueled by several key factors that have turned what was once a declining health issue into a resurgent global challenge. One of the primary reasons for this resurgence is the rise of drug-resistant strains of Mycobacterium tuberculosis, multi-drug-resistant tuberculosis, MDR-TB, and extensively drug-resistant tuberculosis, XDR-TB, are two forms of the disease that have emerged as major public health threats. These strains are resistant to the most common and effective anti-tuberculosis drugs, making treatment much more difficult, and in some cases, nearly impossible. Drug-resistant TB can develop when patients fail to complete a full course of TB treatment, allowing the bacteria to survive and mutate. Inadequate access to healthcare, poor treatment adherence, and inconsistent drug supplies contribute to the spread of these resistant strains. The rise of drug-resistant TB has been most severe in countries with limited healthcare infrastructure, where patients may not have access to the full range of diagnostic and treatment options. The cost of treating MDR-TB is significantly higher than treating regular TB, and the treatment process can take years, often involving toxic and less effective second-line drugs. The burden of drug-resistant TB is felt most acutely in regions such as Eastern Europe, parts of Africa, and Asia, where healthcare systems struggle to cope with the demands of long-term treatment and follow-up care. Another contributing factor to the reemergence of tuberculosis is the global HIV/AIDS epidemic. HIV weakens the immune system, making individuals more susceptible to tuberculosis infection. In regions where HIV is prevalent, such as sub-Saharan Africa, tuberculosis has surged as a leading cause of death among HIV-positive individuals. Co-infection with HIV and TB presents a unique and dangerous public health challenge, as those with compromised immune systems are more likely to develop active TB and less likely to respond effectively to treatment. This has led to high rates of TB mortality in HIV-endemic areas, further complicating efforts to control both diseases. Additionally, the social determinants of health play a critical role in the persistence and spread of tuberculosis. Poverty, overcrowding, malnutrition, and inadequate healthcare access create environments where tuberculosis can thrive. In many parts of the world, particularly in densely populated urban areas or refugee camps, the conditions that favor the transmission of TB remain widespread. Malnutrition weakens the immune system, while overcrowded living conditions facilitate the airborne spread of the bacterium from person to person. Without sufficient healthcare infrastructure to screen, diagnose, and treat tuberculosis, these vulnerable populations remain at high risk. Migration and displacement also contribute to the global spread of tuberculosis. In recent years, conflicts, natural disasters, and economic hardship have forced millions of people to flee their homes and seek refuge in other countries. Refugee camps, temporary shelters, and overcrowded urban areas often lack proper sanitation and health care, creating environments where tuberculosis can easily spread. Migrants and refugees may have limited access to healthcare services, leading to delays in diagnosis and treatment, which in turn increases the risk of transmission to others. One of the major challenges in addressing the reemergence of tuberculosis is the complexity of its diagnosis and treatment. TB symptoms, such as persistent cough, fever, and weight loss, can easily be mistaken for other respiratory infections or chronic illnesses. In many low-resource settings, access to diagnostic tools, such as chest X-rays and sputum cultures, is limited. As a result, many cases go undiagnosed or are misdiagnosed, allowing the disease to spread unchecked. Even when TB is correctly diagnosed, treatment can be lengthy and difficult. Patients with drug-sensitive TB must undergo a course of antibiotics lasting at least 6 months, while those with drug-resistant TB may require treatment for 2 years or more. The long treatment duration, coupled with the side effects of the drugs, often leads to poor patient adherence. Many patients stop taking their medications once they start feeling better, not realizing that the bacteria may still be present in their bodies. This incomplete treatment not only puts the patient at risk of relapse, but also increases the likelihood that the bacteria will develop resistance to the drugs. Ensuring that patients complete their full course of treatment is critical to controlling the spread of tuberculosis. But in many parts of the world, healthcare systems are ill-equipped to provide the necessary follow-up and support. Efforts to combat tuberculosis have not been without success. The World Health Organization, WHO, has spearheaded numerous global initiatives aimed at reducing TB incidence and mortality. The End TB Strategy, launched in 2014, aims to reduce TB deaths by 95% and cut new cases by 90% by 2035 compared to 2015 levels. This strategy focuses on improving diagnostic capabilities, expanding access to treatment, and addressing the social determinants of health that contribute to TB transmission. However, achieving these goals will require substantial investments in healthcare infrastructure, particularly in countries with high TB burdens. Vaccine development is another critical aspect of the fight against tuberculosis. The Bacille-Calmette-Guerin (BCG) vaccine, which has been in use for nearly a century, provides limited protection against TB, particularly in adults. Research into more effective vaccines is ongoing, with several candidates currently in clinical trials. A new, more effective TB vaccine could be a game-changer in the global effort to eliminate the disease. But until such a vaccine is available, other preventive measures, such as improving living conditions and expanding access to healthcare, remain essential. Public awareness and education also play a vital role in controlling tuberculosis. Many people in high-burden areas are unaware of the symptoms of TB or the importance of completing treatment. Public health campaigns that educate communities about TB transmission, prevention, and treatment can help reduce stigma and encourage individuals to seek care early. Stigma remains a significant barrier to TB control, as many people fear discrimination if they are diagnosed with the disease. Addressing these cultural and social barriers is just as important as improving access to medical treatment. The global community must recognize the reemergence of tuberculosis as a critical public health issue. While many developed countries have seen a decline in TB cases, the disease remains a serious threat in much of the world. As long as TB persists anywhere, it remains a danger everywhere, particularly given the rise of drug-resistant strains. The COVID-19 pandemic has further complicated the fight against TB, as healthcare resources have been diverted to manage the pandemic, leaving many TB patients without access to the care they need. Additionally, disruptions in routine healthcare services have led to delays in TB diagnosis and treatment, potentially setting back global progress by years. Addressing the reemergence of tuberculosis will require a concerted, multifaceted effort. This includes investing in healthcare infrastructure, developing new diagnostic and treatment tools, addressing the social determinants of health, and promoting global cooperation. The resurgence of TB serves as a reminder that even diseases that seem to be under control can quickly return if vigilance is not maintained. Tuberculosis, with its long history as a global scourge, remains a powerful example of the importance of sustained efforts in global health. The fight against tuberculosis is far from over, and only through coordinated global action can this ancient disease finally be defeated.